Dear participants, Assalamu alaikum. I hope you are enjoying this course on social protection. This is Dr. Sajid Amin, your facilitator for today's discussion on theory of change. In next 30 minutes, we will be discussing theory of change of social protection with a key focus on three outcomes: poverty, health, and resilience. We'll also be bringing you some examples, some evidence to support the arguments from a systematic review of literature. And during the discussion, wherever applicable, we'll also be picking some examples from Pakistan's social protection programs and linking the global evidence to the outcomes in terms of poverty, health, and resilience from Pakistan. I will start with the quick introduction of the concept of the theory of change before diving deeper into the evidence based on social protection outcomes. So let's begin by taking a look at the definition of the theory of change. Putting it briefly, a theory of change maps out the expected outcomes of a program or an intervention. When designing a theory of change, you start by defining overarching parameters before identifying root causes, needs, and available resources. Next, the activities are described which lead to outputs and ideally positive outcomes in the desired areas. Social protection can have an impact on many areas, ranging from reduction of poverty rates to improving the health status and the resilience of individuals, households, and entire communities. The exact outcome varies from one instrument or intervention to the other and is highly dependent on the goal, design, and implementation of social protection program. But of course, the final outcomes remains also dependent on external factors as well. Social transfers, for example, can be conditional or unconditional on certain behaviors or actions like school enrollment or health checkups. They can be universal in nature, meaning that everyone in the country is receiving the benefit, or target certain households or communities based on their socioeconomic background or exposure to climate risk. The benefit amount, the frequency, timing, and duration of payouts and actual coverage are also very, very specific to the program. And they can vary across the programs, over the time, and across the regions. All those factors make it hard to generalize outcomes. I will nonetheless try to establish a common understanding for possible social protection outcomes in the areas of poverty, health, and resilience, which does not aim to be exhaustive. We have been particularly focusing on poverty, health, and resilience purposefully, as this remains the major driver behind the social protection programs in Pakistan, including BISP, Benazir Income Support Program. What is generally done in an impact evaluation is that a theory of change is tested. Expected outcomes are tested in order to be able to determine whether the initiative has the desired or unexpected success or even desired or unexpected negative consequences. I will start with mapping the most important expected outcomes in the areas of poverty and link it to existing evidence based on the systematic literature review that we have collected. And that, of course, you can also collect at your own as well. On the individual level, social transfers are proven to lead to increased expenditure for food, health services, and education. There is a robust evidence that this has a positive effect on food security and dietary diversity, the health status, and the school attendance of the beneficiaries. However, there is only limited evidence on the effect on school performance, the learning outcomes. It is reported that school feeding programs lead to a 4 to 11% higher school enrollment rate. Similarly, interventions like social insurance and public works contribute to the income security and serve a protective function for the beneficiary households by preventing or compensating, ensuring for unemployment due to illness, old age, or economic crisis. Those risks constitute a lower existential threat. Social protection interventions can thereby help poor people meet their basic needs, but also protect people above the poverty line to fall below it. And this is particularly, we have seen it in Pakistan, that when there was a serious increase in petroleum prices, there was a Sasta Petrol scheme going beyond the BISP beneficiaries. The purpose was that inflation, which can push many people below poverty lines, they must be protected against the adverse impact of inflation. Skills and job trainings can help recipients to find or sustain employment. Similarly, skills and job trainings can help recipients of social protection to find or sustain employment or even open up their own businesses with the money received from a cash transfer or public works programs. Several studies in this regard found statistically significant evidence that social transfer increases household savings and increases investments in productive assets and lifestyles. In this regard, a study from 2018 brings a very concrete evidence. It argues that public works programs lead to an average increase in income by 11%, per capita savings of 30%, and employment opportunities of 55%. Other studies find that there is a direct income effect, but not post-program. It means that if there is no clearly exit plan, the programs may increase the income and employment opportunities during the duration of the program, but the post-program, the impact phases out gradually. Furthermore, there is evidence that social transfer beneficiaries are considered more credit-worthy and have easier access to the financial market, including loans, and enable them to save. Savings, in turn, can be used to cope with unexpected shocks or be invested in productive asset to generate future income. In this way, beneficiaries of social protection can become independent of transfers in the long term and break cycle of poverty. As can be seen here, ideally the programs are interlinked and increase the possible outcomes on poverty. Social protection also have ripple effects going beyond individual households, the beneficiaries of the social protection. At the community level, this can lead to ripple effects. A common myth is that social protection disincentivizes the participation in the labor market. On the contrary, studies show that transfers do not lead to a reduction in the labor intensity or participation, but increases the number of self-employed in non-agriculture sectors. If a beneficiary opens up a business, other people from the village could be employed. This is what is meant by a change in labor demand. Similarly, school feeding programs are found to support smallholder production, and on the same note, the benefits received from social transfers eventually also flow back into the local economy. Overall, numerous studies demonstrate that social protection interventions like cash transfers have the capacity to reduce the intensity of poverty and the poverty headcount. When it does not have an effect, this is often due to faulty program design or a weak implementation, such as low benefits level or infrequent delivery. The overall productivity is set to increase, and with it, the economic performance of a country. A very recent study from SDPI Pakistan also shows that social protection spendings, including other health and education spendings, have a very significant impact on increasing GDP growth, reducing income inequality, reducing poverty. This study is available online as well. Concerning health, social protection programs like school feeding have the potential to boost the immunity by increasing the quantity and quality of the diet. The income and consumption smoothing through social protection also contributes to the dietary diversity as mentioned on the previous slides. The reduction of short-term hunger can in turn influence the school performance positively. All this together leads to building up human capital, or you can call human capital accumulation. While cash transfers are the most common practice in Pakistan, they are proven to have a significant positive impact on general health outcomes by increasing the number of health visits, rising vaccination rates, and reducing morbidity and child mortality rates. There is also robust evidence that fertility rates are lowered as female beneficiaries of cash transfers delay marriage and the number of non-HIV sexually transmitted infections are reduced. The access to general health services is increased by introducing health insurance or occupational health schemes. Evidence shows that the number of preventive health examinations is considerably grown when health insurance is introduced. Health insurance also reduces out-of-pocket spending on health costs, which in turn reduces the livelihood risks of illness. In this context, it will be very interesting to see the impact of Sehat Sahulat Card in Pakistan as it has been launched a couple of years. So it will be interesting to see how it has been performing on these dimensions that we have discussed. However, at the same time, many cash transfers are conditional on preventive examinations or are linked to free access to health services. Staying with cash transfers, the benefit amount may be used on health services and reported to be used for the purchasing of sanitary products such as soap. This does not only reduce the number of diseases, but is also found to have a positive effect on the willingness of children to attend school. Further, the community can also benefit from a better quality of health services and potentially the development of better health infrastructure, closer and more sophisticated facilities available near places. Even community members without free access to health insurance will benefit from higher vaccination rates and reduced spread of infectious disease. On the national economy, the increased health status is proven to decrease the amount of health-related absence from work. Beyond this, healthy aging is promoted, leading to a longer work life. This will eventually lead to an increase in the labor productivity, empowering women to hold and find employment or open up an own business, and educating them about contraception has been shown to lead to women marrying later on average and having children later, but also fewer children in total. And this has very significant implications for Pakistan. One of the key problems that Pakistan has been facing is the higher population growth, which is really hurting Pakistan's trajectory to sustainable development. In terms of resilience, social protection can strengthen the recipient's adaptive capacity and minimize the likelihood of the occurrence of idiosyncratic risks. I think it is important here to understand the different types of shocks actually. But let me begin by explaining what a shock means actually. A shock is an event which leads to a significant welfare loss of people. Majorly, there are two types of shocks. The first is the idiosyncratic shock. It is actually called also the micro level shock. It affects individuals or the households. For example, illness, injury, death in a household, job loss. This is idiosyncratic loss. And the implications are significantly limited to the households in which the shock happens. But then there are the covariant shocks. As the name shows, covariant means these shocks are common across the larger number of people, larger number of households, across the community, across the region, and across the countries, and maybe at a global level. For example, the floods, recent floods in Pakistan are a covariant shock which has affected larger proportions of the Pakistan community. At the same time, Ukraine and Russia war is even a global level covariant shock. The rising petrol prices, rising food inflation, higher energy prices are affecting the people across the world, and more so to the marginalized and poor people, because the food inflation is really picking up. And generally, there is an evidence in Pakistan that, the number varies actually, but there is a discussion that around 50 to 70% of household income of poor people goes to the food basket. So if there is a significant rise in food inflation in Pakistan or in any other country, the poor have to spend more of their income to maintain the same basket level. So this is a covariant shock. As mentioned earlier, individuals and households are encouraged to invest in productive assets and diversify their income through productive investments and empowering women to enter the labor market. Especially the marginalized groups can have a better access to the labor market through inclusive labor market policies, access to education and skill development trainings. The aforementioned increased savings can also be used to carry out repair and maintenance work on the house or apartment so that it can better withstand extreme weather events. These investments can also be invested in self-employment. However, evidence is still scant on the positive effects of cash transfers on resilience to climate change and disaster shocks. One interesting finding here it can be that you may explore at your own that what is the driver of the savings of the poor people, particularly the bottom 20%. We have seen there is an argument that these savings may be forced saving, which these families have to save to repay their loans back actually. So this will be interesting if in your own areas, the regions that you are coming from, if you can sort of analyze that what is the purpose of the savings that poor household are, those who are the beneficiaries of social protection are saving actually. Let's not forget about the social insurance. The common insurances like pension, unemployment, and health insurance have been found to protect the livelihoods of the insured in the events of the risks that threaten their existence, such as illness. The local economy is likely to be more resilient to covariant shocks. When the lives and livelihoods of individuals and households are better protected and their income is better secured. In addition, social protection has the potential to lower the barriers in accessing social services for previously excluded populations by targeting them explicitly and, for instance, introducing the quotas. At a country level, at a more macro level, the economic system will be better protected from macroeconomic shocks. When households are able to cope with risks better by themselves, the dependency on the welfare will be lower. Overall, a shift to social insurance is helpful to get away from welfare dependency and to help only marginalized groups and transitionally with welfare benefits. Again, at this point of time, I would like to leave you with one very interesting question that your departments may look into. Does the social protection increases fiscal space? There is now evidence emerging that social spendings, particularly the social protection spending, has a fiscal multiplier. One of the key arguments in Pakistan when it comes to lower spending on social protection is that we have a very limited fiscal space. But is there a causality otherwise as well? That if you spend on social protection, it may increase the fiscal space by increasing human capital accumulation, labor productivity, economic activity. So this will be an interesting change of argument from the low limited fiscal space and low social protection towards a higher social spending, social protection spending, and then a higher fiscal space actually. In the later case, the social protection spending are actually the investment enhancing economic activity and the fiscal space of a country. Given that in Pakistan, the major instrument of social protection is the cash transfers, I am sure you will be interested in the theory of change of cash transfer programs. You might want to have a look at the following systematic literature reviews. Most of the evidence in terms of social protection outcome is collected on cash transfer programs. There is still need for much further research on different social protection interventions like public works, programs, and school feeding. Let's now connect the outcomes back to the theory of change, what we have been discussing. This is an example of the Benazir Income Support Program, shortly known as BISP in Pakistan, Pakistan's umbrella social protection program. As you know much better than us on the BISPs coming from the social protection departments, I will not be going into details of BISP. It is important to notice that theories of change differ across interventions as they have different objectives, design, and implementation features. Generally, impact evaluation focus on the direct effect of the program, while the spillover effects to the community and country should not be neglected, as we have seen on the previous slides and as we have discussed, that social protection's impact goes beyond the beneficiaries. If in a society, the beneficiaries have a good health, low infectious disease, better enrollment, better education, it benefits the community and at a macro level to the country. So our impact evaluations on social protection impacts need to go beyond the direct impacts and must also consider the indirect impacts that will actually bring the actual value addition by the social protection spendings and the social protection programs. Cash transfers like the BISP financed by taxes or development assistance are most often used to tackle multidimensional and persistent poverty. The BISP has the explicit goal of reducing poverty by providing needy households with female members and are members of the disabilities with an unconditional cash transfers. But at this point of time, I would also like to highlight a discussion that is going on in Pakistan, and I would like you to think on that there are two opinions on the BISP. The one is that BISP is a consumption smoothing program and not a poverty reduction program. Why do you think we would leave it on you? The need was found to be the persistent incidence of poverty, income and food security, and the low agency of women. Whenever we design a program or intervention, we have to rationalize it. And that is known as a need. That why do we need this program or the intervention? In context of Pakistan, poverty, income, and food insecurity, and the low agency of women or the empowerment of women has been put as a major reason behind the need programs like BISP. It's important to sort of differentiate between women empowerment and the women agency. While the women may be technically empowered, giving the indicators of empowerment such as education, working women, but the application of empowerment is actually the agency which matters. How independent and educated and working women is to make household decisions, decisions of her life, decisions about children. That is actually the agency. And what matters is how a social protection program improves the agency of the women. In addition, families need to be able to rely on regular streams of income to be able to invest in productive assets and activities such as starting their own small business. Lastly, women in Pakistan were looking for greater agency to be better aware of their rights, socially accepted and involved household decision making. And in this regard, BISP is one of the major programs which is designed around increasing the empowerment and agency of women. That is why the women are the primary beneficiaries. In the case of activities, this is almost identical in case of cash transfers. After the initial rollout in 2018, services and transfers were gradually added on. A cash transfer conditional on school enrollment in public schools and a top-up in case of shocks like floods are now linked to the BISP. The top-up of the transfer amount is called vertical expansion. In times of shock, the transfer can also be horizontally expanded to include more beneficiaries, as we witnessed in COVID-19 and most recently now in floods in 2022. Usually, researchers differentiate between output, outcome, and impact. The output in the case of the cash transfer is the benefit amount that households receive. Impacts have a longer term effect than outcomes which are measurable also over the shorter time horizon. For the ease of simplicity, we will use the term outcomes mainly. Let's assume that the transfer amount is linked to the consumer price index, which is inflation, CPI, which we call inflation. The change of price. The rate of change of price is called inflation. So if a program is linked to inflation, it means if there is a higher inflation, there will be increase in the cash transfers. In this context, social protection can help people maintain their purchasing power when there is a rise in the prices. So the first order outcomes generally are the direct result of receiving benefits, in this case, the transfer. It is expected that the benefits increase expenditure on food, health, and education. It is further assumed that households spend more on productive assets and activities to sustain the positive income effect of the transfer. Thereby, the transfer is encouraging more long-term and riskier decision making. While in BISP, we see that there is we don't see a direct link to CPI, or there is no direct increase in the cash transfers annually, but there has been increases over the time. We remember a very interesting example when we were doing a study with the BISP that let's see there can be an idea of real purchasing power. That is how much I can buy with the cash transfers back in 2010 and now in 2020. So one simple example that we gave, very interesting example, was for the simplicity that how many chapatis you could call it a household can buy with the cash transfers it receives. So this is very simple idea to give how to intact the key purchasing power of the beneficiary households intact. Second order outcomes include behavioral changes as a direct consequences of the transfers. The BISP, for example, is expected to increase school enrollment and decrease retention rates as well as the uptake of health services, lead to labor participation and a greater agency of women. This means that women are more involved in household decision making as the transfers enable them to contribute to the family income. Consequently, they have a better social standing, better access to economic, social, human, and psychological assets. At a more macro level or the wide range levels, or the long-term impacts of the BISP are the third order outcomes, which include positive impact of the program, transfers, and other interventions on the health status, psychological well-being, nutrition, productivity, school performance, and resilience to climate disasters and other shocks. This also includes a reduction of poverty and social inequality. You will find out about the actual outcomes of the BISP in one of your next exercises as found in an impact evaluation. With this, I would like to thank you for listening and watching this session on theory of change. While this is a very only online session, I look forward to engage with you in face-to-face sessions, which are designed in this course as well, particularly the module 2 and module 3 of this course on social protection. I once again thank you.